Hello, everyone. Thanks so much for joining this very important healthcare webinar. My name is Vinnie DeMarco. I'm the president of the Maryland Healthcare for All Coalition, and we are thrilled today to be with you to talk about the fact that tomorrow begins open enrollment in Maryland for health plans. And we want to today talk about the progress we're making in Maryland, the challenges coming from the federal government, and what we're doing in Maryland to protect the progress we've made and to continue going forward. I know that we're all proud of the fact that we've gone from 13% uninsured to 6%, which has helped 400,000 Marylanders get health care coverage and reduce uncompensated care by over $460 million, which helps all of us. But we have to keep going forward. And we've got three terrific panelists today who are going to talk to you about where we are today and how we're going forward together in Maryland to continue making progress. And I'm really pleased to start this discussion with one of my all-time heroes, Michele Eberle, who's the longtime executive director of the Maryland Health Benefit Exchange. And I have so many colleagues around the country who say to me, your health exchange is the best in the country, isn't it? I say, absolutely it is. We are so proud of everything Michele has done because the progress we've made in Maryland has not been made everywhere. And I just want to thank Michele and her terrific team for all they've done. And I also want to thank the Healthcare for All team, Stephanie Clapper, Suzanne Schlotman, and our terrific interns, Jesse Havlin and Gabby Robinson, for all they've done, put this group together, this webinar together. So right now we're going to start with Michele giving us an up-to-date update on where we are on healthcare coverage in Maryland with tomorrow beginning open enrollment. So I'm going to turn it over to you, Michele, and we'll get going.
Thank you so much, Vinnie, and thank you and everyone at Healthcare for All, not only for putting on this webinar, but for all the work you do in Maryland to really make sure that we continue to get healthcare for all in our state. And as I don't need to tell you, but we all know, without having health coverage and health care, it affects our entire state. It affects our economy. It affects the well-being of our neighbors and our friends and our family. So we are here to make sure that we lessen the impact to Maryland as a state by making sure everyone has health care. So let's talk a little bit about the individual marketplace and where we are right now. Open enrollment is here, and I will go to the next slide, please. It starts tomorrow. This is the first time in many years we've had open enrollment start on a Saturday, but tomorrow at 5 a.m., MarylandHealthConnection.gov will be open, and you will be able to start selecting or changing your health plans and actually committing to a plan for January 1st coverage if you enroll by December 31st, and if you enroll by January 15th for February 1st coverage. Next slide, please. So there is a lot that has changed this year. We had, I called our triple whammy in earlier this year, we had the final marketplace program integrity rule, or marketplace integrity rule that came out that implemented some changes. Some we had to enact right away, some will happen in 2026. Second to that was HR 1, also referred to as OB3, also referred to as another name that I don't call it because I don't agree with it. So I refer to it as HR 1, but that has significant impacts now and again, more in the future. And then the third impact this year is the fact that we have not had the enhanced tax credits extended beyond the end of this year. And so I'm going to talk a little bit more about each of those. So some of the things: immediate deferred action for childhood arrivals, DACA recipients, effective August 25 of this year, the end of, actually it was August 25th, we could no longer enroll DACA recipients into coverage. And this is, again, coverage that individuals are buying with their own hard-earned money, and they're using taxes that they would have sent to the federal government to use that in advance to help them with their coverage. No longer able to enroll anyone beyond August 25th. Second to that, and I'll just say we had about 300 enrollees in that category. Second to that, the end of eligibility for financial assistance for lawfully present immigrants. Now, this is a group that earn under $15,600, which is 100% of the federal poverty level. And they used to be able to use tax credits to help them afford coverage. We can no longer do that. For that population, we did enroll them in coverage. There's about 18,000 of those consumers, but we know that it may be unaffordable for them to pay their premiums. So we're going to keep a close eye on that. Other changes, application changes, reduced time to submit verification documents. This isn't a significant harm. It just is a little more of a road bump. Documents need to be submitted within 90 days. There was an additional 60-day period that was eliminated. Again, not a big hurdle, but still a hurdle. And then the end of special enrollment period for certain households. So those that were earning less than $23,475 would be able to roll in a special enrollment period. That has been eliminated. Those individuals will have to wait till an open enrollment period or a life event change, such as a divorce, marriage, loss of employer-sponsored coverage, etc., to enroll in coverage. The biggest one that we'll talk about is the amount of tax credit that can be used to lower monthly premium bill. That was reduced. Now, again, it's in place for the rest of this year, 2025, but it will expire unless Congress takes action. We spent an awful lot of time earlier this year trying to educate folks. In fact, back in February, no one was talking about the enhanced tax credits. So we kept informing both our state legislature and the federal delegation that yes, this is going to have an impact. It's going to have an impact come the end of October when we mail notices out. So lo and behold, we have a government shutdown. What's at the top of that government shutdown, but is expanding those tax credits. So now everyone's aware of the issue. Sadly, we had to roll out the renewals without that enhanced tax credit. However, many thanks again to our Maryland legislature, our Moore Miller administration, to Vinny and all your efforts. We really thought ahead in Maryland. And back in January, we introduced legislation that would allow us to use some of our reinsurance funding to help plug the hole for what we anticipated would be a loss of the ability to use tax credits. We were able to do really well for individuals earning $200,000 federal poverty level, which for one person is $31,300. We were able to 100% backfill that. So those consumers should not see much of a difference in their tax credit. Between that 200,000 and up to 400,000, again for an individual 62,600, we are able to do a 50% stopgap on that. So a little bit better than losing that tax credit ability completely. And then for those that are over 400% of the federal poverty level, we were not able to do anything. So that will be a significant impact. What we had anticipated without the ability to use those tax credits is that individuals who use tax credits to help purchase their health coverage, they would see a 95% increase in the premium that they would have to pay. By putting in that state subsidy program, we were able to reduce that down to, on average, a 35% impact. So again, not 100%, not the best scenario, but a lot better for Marylanders. Next slide, please. So how are we supporting our community through all of this change? I just talked about the new state premium assistance program. Again, 100% enhanced tax credits will be replaced for under 200%, between 200 and 400%, 50%. One thing I did not mention is that we still will keep our commitment to our young adults. Those between age 18 and I think that's 34, not 37 for this year. They have been receiving extra savings since 2021, and we will continue that in 2026. So that program has been phenomenal. A third of the on-marketplace enrollees are under the age of 34, so it's really been helpful. We have a whole bunch of consumer assistance available. MarylandHealthConnection.gov/help. We have our call center, 855-642-8572. You go online, you can talk to Flora, our virtual assistant, whether you're in your application or not in your application, we'll get you help. We have live chat available. Enroll MHC is our free mobile app, and you can upload documents there. You can apply end-to-end coverage right there on the mobile app. Broker Connect is a feature we offer where you can ask for a broker to connect with you within 30 minutes. We have over 2,000 licensed authorized brokers that are available to help Marylanders. And again, this is within 30 minutes or less. And then all across the state, we have free in-person and virtual phone enrollment assistance by our navigators and our brokers. And then finally, stay informed, MarylandHealthConnection.gov/what's new. Sign up for text alerts, email notifications, or attend one of our upcoming virtual events. We will be communicating as things change on a daily basis. And we don't know what tomorrow will bring out of the federal government, but we are ready to respond to whatever comes out. Next slide, please. And this slide just shows the upcoming virtual events. Again, you see a couple there. We also will be doing something new this year, which are virtual enrollment events. And that's going to be the opportunity for consumers to come on a Zoom call, get connected with a broker via Zoom call, one-on-one in a breakout room, and then just walk through the application process and help enroll. So that's something new we're adding on to try and bring a little more assistance to our consumers. And I believe that ends my slides, but let's see what's next here. Next slide. Yep, that's it. All right, thanks, Vinny, so much for the opportunity to be here today, and I'll hand it back to you.
Thank you very much, Michele. We really appreciate it. And we're going to have an opportunity for people to submit questions to our panel. So you could put questions in the Q&A right now. And I just want to let everyone know that we have over 350 people registered for this. Almost 200 people are on the webinar right now. There's so much interest here. And thank you, Michele, for your leadership and so much you've done and for being here. We really, on behalf of the Healthcare for All Coalition, really thank Governor Westmore, Lieutenant Governor Runa Miller, and her whole team for the terrific job they've done to protect Maryland's healthcare and continuous going progress. We also have with us Associate Commissioner for Education and Consumer Education of the Maryland Insurance Administration, who's been at MIA for 13 years, who will talk with us a little bit about what's going on from their perspective. Patti Dorn, welcome, all yours.
Thank you, Vinny. It's great to hear about those virtual events, Michele. That's really exciting. I'm Patti Dorn. I'm with Maryland Insurance Administration. Maryland Insurance Administration is the Maryland entity that regulates the business of insurance in Maryland. So we would be the ones that are making sure that those plans that are sold on the Maryland Health Connection are following the laws. So the Maryland Insurance Administration is your Maryland state entity that licenses those insurance companies to do business in Maryland, and we license the agents and brokers as well. We examine their business practices and we make sure that they follow Maryland laws and any applicable federal laws. We're the entity that makes sure that the insurance companies that are operating in the state of Maryland are solvent. And what that means is we're making sure that they have the money to pay claims. We review the policies in our office, and we review the insurance rates to ensure that the rates are not inadequate, excessive, or unfairly discriminatory. In the case of those plans that are sold on the Maryland Health Connection, those go through an extensive review before we approve the rates for the following year. As well, the Maryland Insurance Administration investigates consumer and provider complaints. So those are your complaints. You don't think your insurance company is following your policy, or you don't think your insurance company is following the law, you can file a complaint with the Maryland Insurance Administration, and we will investigate that situation. So the Maryland Insurance Administration regulates about 34.5% of commercial health insurance coverage in Maryland and 20% of all health insurance coverage. So I'm going to step back and help you understand what that means. So we regulate the business of insurance. And so for the most part, if we're talking about an auto insurance product, or we're talking about, say, renter's insurance, we regulate almost all of those markets. But with health insurance, it gets a little complicated because not all people in Maryland who get their health insurance get it from a commercial insurance product. So for example, everything that's sold on the Maryland Health Exchange, on the Maryland Health Connection, is a commercial insurance product, except for Medicaid. And so that falls under our jurisdiction. However, something like Medicare, et cetera, which is a federal program, isn't going to be something that we regulate. And this slide goes into a little bit more detail here, and I'll go through it with you to help you understand what this means. And so individual and employer-based health plans that are underwritten by a carrier, those are regulated by us. But some people get their health insurance from their employer, and it's considered self-funded. And what that means is that your employer actually owns that pile of money. So it doesn't fall under the jurisdiction of the Maryland Insurance Administration. We regulate, again, those plans sold on the Health Connection, as well as the small business plans. We regulate the Medicare supplement plans. And then we also regulate underwritten products that are limited in scope. An example is long-term care insurance, which is a health insurance product, vision, dental, and then there are some limited benefit health insurance products as well, and those fall under our jurisdiction. We do not regulate medical assistance, Maryland medical assistance, so Medicaid, Medicare Parts A and B, and those Medicare HMOs, the Medicare Part C, Medicare Advantage. There is an asterisk there because we do regulate the Medicare Advantage plans for solvency. And so where those asterisks are means that we do have a limited scope of regulation, such as in the case of the Medicare Advantage plans, we're making sure that those companies do have enough money to pay your claims. We don't regulate self-funded or self-insured plans, VA, or commercial health insurance that's been issued outside of the state of Maryland. So it does matter where it was issued. It does need to have been issued in the state of Maryland. So as I said before, you can file complaints with us. When it comes to the health insurance complaints, they're going to fall into two buckets. You might be filing a complaint that says, in my contract, in my health insurance contract, I'm entitled to this, and my insurance company is saying no. So that is a complaint on the contract side. A complaint on the appeals and grievance side is saying, my provider believes that this is medically necessary for me. I need this drug. I need this procedure. And my insurance company is saying no. And that's going to fall on the appeals and grievance side. Now, as a consumer, we know which side your complaint falls on. So you don't have to sweat. You don't have to sweat that part with us when you're filing a complaint. But it's just for you to know that with regards to the appeals and grievance side, we operate a 24/7 line. Medical necessity and emergency appeals has a 24/7 line that is available for those complaints. And so Maryland law requires a carrier or its delegated private review agent to ensure that a representative is reasonably accessible during those times to the patients and the healthcare providers. And the representative must be available to assist with the initial authorization requests as well. All right, so let's talk a little bit about consumer education and advocacy. That is my group. My group is responsible for putting this material in front of Marylanders and helping Marylanders to be as educated as possible with regards to insurance. And again, that's all lines of insurance. We're here talking about health insurance. So you're going to see my team at in-person community events and fairs and libraries and farmers markets. We give online presentations and webinars. Some of them are general, some of them are we're telling you how you can interact with us, or by request, we might focus on a specific insurance product. We make lots of informational materials and other items to engage consumers. Some of them are high level. We try to make some of them short and sweet, flyers and trifolds, and some of them are more in depth. We have documents about auto insurance and homeowners insurance that, that might take you a couple hours to get through. And that can be a good thing if you really want to know all the nitty gritties, all the little details about an insurance product when you're shopping for that. And then I do want to talk about our health coverage assistance team within the Maryland Insurance Administration. So I talked about regulation and the fact that we at the Maryland Insurance Administration only have jurisdiction over a certain percentage of the health insurance products sold in Maryland, or the ways that you get health insurance. However, we operate the health coverage assistance team. That is a no wrong door program, which means that the MIA itself, when it comes to health insurance, is no wrong door. If you get to us and we do not have jurisdiction over your health insurance, we're going to send that to the health coverage assistance team. And this team is going to be available to get you where you need to go, including holding your hand through the process. It's more than just them throwing a phone number at you and saying, reach out to this person. If you want somebody from the health insurance assistance team to stay with you through the process, they'll get you over to where you need to be, and they'll check up on you to make sure that your situation is being resolved. They're going to listen, provide information. They're going to explain how the process works and help resolve the issues or connect you again to the right entity, should it be something that we don't have jurisdiction over. Organizations that help consumers can use HCAT too. So it's not limited to just consumers. If you're an organization and you are working with a consumer, you can reach out to us as well. And you can also reach out to us for training opportunities. This is the last page. I think this is my last page. Yep. This is how to reach the HCAT, the health coverage assistance team. We've got a phone number. There's an email as well. You can shoot us an email and a health insurance specialist will get back to you in 1 to 2 business days. That's what I got.
Terrific.
Thanks, Vinny.
Yes, thank you. Thank you very much, Patti, for that terrific presentation. You and our wonderful Commissioner, Marie Grant, are doing a terrific job, and we're very thrilled that you could be here with us, and you'll be open to questions in a minute too. So now I'm very excited to introduce our wonderful Secretary of Health, Dr. Meena Seshamani. And Dr. Seshamani serves as the Secretary of Health, overseeing 9,000 employees, spanning local health departments, public health, Medicaid, disability, and behavioral health administration, and 11 in-state hospitals. She previously served as Deputy Administrator and Director of the Center for Medicare at CMS, and as a former clinical leader at MedStar Health here in Maryland. Her diverse background as a healthcare executive, health economist, physician, and health policy expert has given her a unique perspective on how healthcare policy and operations impact the real lives of patients. We are thrilled that you are our health secretary, and thank you very much for taking time for your busy schedule to be for us. As I said earlier, we have almost 200 people on this webinar, over 350 have signed on, and we'll get the recording. So we're all eager to hear from our wonderful health secretary.
Well, Vinny, thank you. And it's really great to be here with all of you. And I appreciate those of you who've taken time out of your day to join us, and also to my fellow speakers, Michele and Patti. Thank you for the information that you're sharing, especially as we're heading into open enrollment. And if I may, I'd like to share a few additional highlights from the Maryland Department of Health perspective. Starting with, we are in some very uncertain times. It's a challenging time. There's a lot of headwinds to navigate, particularly with changes at the federal level. And we all see and appreciate the distress that this can cause for people. The healthcare system, even on a good day, can be complex to navigate. I think this is something that many of us who work in the healthcare space have continued to work on. And now there's even more uncertainty and need to be able to navigate. And I want all of you to know that I am committed, and my team at the Department of Health are committed to protecting and advancing health and well-being for all Marylanders and protecting that healthcare access that everybody needs to live their best lives. So if I may, I'll walk through a few different areas that we are focused on. First, starting with marketplace coverage. As chair for the Maryland Health Benefit Exchange, as Secretary of Health, but also, as Vinny mentioned, I'm a former head of the Medicare program. I'm a physician. I'm also a mom. I'm a daughter. I know that affordable and accessible healthcare is critical for us to protect and advance the health and well-being of our residents across their lifespan. And I'm very grateful for the work that Michele and the Maryland Health Benefit Exchange do, as thousands of Marylanders get covered through the Maryland Health Connection. Under the leadership of Governor Moore, we've seen an incredible surge in coverage. The record enrollment was driven in part by an increase in enrollment among young adult, Black, and Hispanic individuals. And we cannot afford to lose ground. We know that we are seeing raised premiums, and that this can continue to be a problem if Congress does not take decisive action to extend tax credits. And this is something that we are following. I think, as Michele laid out, thank goodness we are in Maryland, where we have some support available to be able to help, but certainly not eliminate what is happening right now in terms of premiums. From Marketplace, I'd like to turn to Medicaid. As you know, recent federal action also makes significant changes to Medicaid eligibility requirements in the law HR 1. These changes will begin in October 2026, so they are not in place now. These changes could cause 175,000 Marylanders to lose coverage when they are implemented. However, this is something that we are all linking arms and working on to make sure that we can have everyone who's eligible for Medicaid stay enrolled in Medicaid. We know that if there are significant drops in coverage and these cuts, it becomes harder for people to access healthcare. It reduces payments for healthcare providers across the state, and that will stall economic growth in one of our largest sectors, along with raising healthcare costs for all Marylanders and Maryland businesses. And we know that Maryland Medicaid delivers life-saving healthcare coverage for more than 1.5 million people. That's a quarter of our state, and almost half of all children in the state. So we are taking this very seriously on protecting and preserving access to health coverage. We are hard at work with our partners, including many of you. We will have to work together to make sure that the new work requirements, the every 6-month eligibility that's for the Medicaid expansion population, that those things are implemented in a way that people can understand what they need to do, that they can navigate, that they can get the health care that they need. And we will want to continue working with all of you on this as we move forward. This, again, will only go into effect in the end of 2026. So talking about Marketplace, Medicaid. Now I'll turn to our work on vaccines. It's so important for all of you to know that the health of Marylanders is really possible through broad access to vaccines in our state. Vaccines are one of the best and most powerful public health tools that we have. So it is so important that we make sure that families and individuals are able to find and receive the vaccines that protect them and keep them healthy. And this is something for all of us to do together. We know that it's a confusing time. There are a lot of different messages out there, including from the federal government. We have done everything within our authority in the state to ensure that Marylanders can access vaccines. We will make sure that Vinny shares the links for you that you can share with your networks on the actions we've taken. For example, number one, we issued vaccine guidance for both clinicians and for individuals, including for kids and those who are pregnant. You can find those recommendations on our website. It closely mirrors the guidance from major medical associations. In addition to issuing our guidelines for vaccines, we also issued something that's called a standing order. That's a prescription for any Maryland resident 6 months and up who wants a COVID vaccine to be able to get one in our state. And I will say that vaccines are especially important right now during the respiratory virus season. Flu, COVID, RSV, these are all much more common, and without vaccines could potentially make people quite sick. These viruses do continue to cause significant illness and death in our communities. So I want you to know that Maryland's public health officials, we will continue to use science-based guidance, and we want to be a trusted resource for you as you are determining what is right for you and your families. So I think overall, we covered a lot of ground, and I will wrap up by saying that it is clear that together we must strengthen, not cut, not weaken the programs that make it easier for families to live, grow, and thrive. We in the state of Maryland and in the Department of Health will do everything we can to ensure care and coverage remain affordable in our state, and that families can access the care they need when they need it. The current federal government shutdown, some of the other headwinds that we've talked about, they do put more challenges and complexities in place. And I am so grateful to be part of an administration that is doing everything it can to protect its residents while we continue to build that high quality healthcare system that produces the best possible health for Marylanders. So we've got your back here at the department, and also a huge thank you to all of you for your engagement, your partnership, because together we need to provide the information and the tools for people to be able to navigate this challenging time, to be able to stay healthy. Vinny, I'll turn it back to you.
Well, thank you so much, Dr. Seshamani, for that wonderful presentation. We are so lucky you're here. And one of the reasons we love about Governor Moore is that he picked you for our health secretary. So that is great. And as I said earlier, we are very grateful to the Moore-Miller administration for its leadership on healthcare. The governor said in his inauguration speech, getting healthcare for everybody, one of his goals, and he is certainly working in that direction. And we also thank the Maryland General Assembly for all it's done over the years. Some of them are in the audience right now. Thank you for all you've done to make Maryland a leader. But before we open it to questions, I want to close out with one of my other heroes, Reverend Dr. Sandra Conner, who is the first woman president of the Baptist Ministers Night Conference of Baltimore and vicinity, and she'll close us out before we open it up to questions.
Good evening, everyone. Good afternoon, everyone. What I'd like to simply say that Dr. Seshamani, you pretty much closed it out for us because you were speaking the language that I like to hear. You talked a lot about us being together. You talked a lot about the fact that we are doing things together to make a difference for the people of Baltimore and Maryland throughout. I appreciate the fact that each and every one of you who've been on this call today have said something of substance and we can walk away from this Zoom call today. We've gotten information about how we can go to the Maryland Health Connection and get insurance. What I like that we need to share and walk away with though is information about how our young people ages 18 to 34, if you did not know that, can perhaps get insurance cheaper than what they had before. I like the fact that our Maryland Insurance Agency, Dr. Patti, talk about the fact that there is protection about our insurance issues that we may have and challenges. I did not know that I could go there and I can make a complaint at 24 hours a day if I needed it. Didn't know that we can go to a place that wanted to protect us when we had insurance issues. And I love what we just heard today, in addition to all the other things we've heard from Dr. Seshamani. I want to say to each and every one of you, we've gotten the information. Now we've got to take it to go forth and make a difference. We've gotten the information. We got to continue to hear something, say something, and then do something. We got to make sure that we don't get this information, don't share it with anybody else, and don't make a difference. I also like the fact, though, that you talked about the fact that Dr. Seshamani, that we're going to have some change. We got some challenging times. Yes, we do. And we have to acknowledge that these times are challenging. But for me, being a faith leader, I have to acknowledge that although we've got challenging times, that we have to keep hope, keep faith. We got to understand that the key word that I heard you say is that we got to be united. We got to work together. We can't just simply have you do things from your perspective and your end, and we not go forth and do what we need to do. We've got some action items based on what I even heard you say today. When you talked about Medicaid, there are things I heard you say that we need to do. We need to look at how we can make sure people do their work things or whatever their requirements are. We as faith leaders can do those kinds of things to make sure people get to do what they want to do. And I do want to also say too that people are thinking that Medicaid was going to end now. Well, you got to October of next year to get yourself in order. So I want to again thank each and every one of you for being on this call today, to be a part of it. But I want to also challenge you. You've heard something, you've seen something. Now I'm challenging you to go do something. That do something is go and tell somebody else who may not have been on this call today, who may not know all that you've heard today, who may not even know that health is wealth, may not know, as Vinny says, that health is for everyone and that we need all to make a difference. We don't think about our health as being something of significance, but I challenge you to think of your health in a totally different way than you ever did before. Not only your health, but everybody's health to make a difference. We need you all to stay healthy. We need you all to do what you do, because with your health, we can do a whole bunch. Your health, our health is wealth. And with God's grace and mercy, we'll be fine. Thank you all for being a part of this webinar today.
Well, thank you, Reverend Dr. Sandra Conner. That was a great moving way to close us out and go into our question and answer period. First, I want to make sure everybody knows that two of Dr. Seshamani's great aide deputies, Perry Briskin and Meg Sullivan, are also here to help answer questions if necessary. And we're going to take a group picture of everybody. So come on a screen if you want to be in the group picture that we have of this wonderful group. So the way we're going to do this is I am going to ask the question, and I will say that I will make a guess at who should do the first crack at the answer, but then everybody else can certainly chime in. And don't mind, I'll have to put on my glasses to do this. So now we're going to answer the questions from the folks. And first from Kathleen Doyle, and I think this is probably for Michele, but everybody else can certainly answer. Anything that folks who are already enrolled need to do? Will they stay enrolled in their current plans? I guess that should be for Medicaid or for individual plans. Go ahead. Do you want to start,
I'll
Michele?
talk about individual plans because we're in the open enrollment period, and that's what's a forefront right now. We are encouraging everyone to come back and look at their plan selection. Now, you do not have to do anything. If you like your plan, if you're content with what you have and you take no action, you will be renewed in the current plan you're in. One caveat to that is we did have Aetna leave the marketplace. There's about 5,000 enrollees that were enrolled through Aetna. For those individuals, we have auto-renewed you in a very like plan that you were in. And I believe they all went to Care First because it had the closest match plan. So where we sent separate notices and said, please come back and make sure this is the plan you want to be in. However, the big caveat for this year is prices have gone up. And so we encourage everybody to come back in and look at their plan, make sure the plan makes sense for your needs, your family's needs. And again, we are ready to help between our brokers, our call center, and our consumer assistance workers to help you navigate that as you go through open enrollment.
Thank you, Michelle. Anybody else want to chime in? Okay, I think this one is also for Michelle. Will there ever be the possibility for the Maryland Health Connection to assist small businesses less than 10 with the provision of health coverage for their employees? And that's from Patrice Wallace.
Well, we're really excited because we just launched our new improved small business portal in September. And so we have made it much easier for small businesses that would like to offer their employees multiple carrier options. So if one wants Kaiser, one wants Care First, United, we now have that ability to do that behind the scenes, which we never had before. So hopefully that will make it a little easier to provide good options to your employees. We are looking at what's coming down with the ICRAs, which are individual coverage HRAs, other things that are going on at the federal level, trying to help influence some things at the federal level that would be better for small businesses and build those into the marketplace. So stay tuned. We are always looking for ways to make the small marketplace more affordable and more competitive for our small businesses in Maryland.
Thanks, Michelle. Anybody want to add anything? Stephanie, did you want to add something? Okay. Nobody else. All right. This one I think is for Dr. Seshamani and her team. How will funding for this is from Lance Kilpatrick from the American Cancer Society. How will funding for the breast and cervical cancer early detection program and the tobacco use prevention and cessation programs be impacted by federal actions? Will the state backfill any cuts from the federal government? And is the state going to continue with cancer research funding to UMMS and JHU?
Dr. Sullivan, I'll turn to you if you want to answer that.
Yeah, I think first I'll say thank you for such an important question. And I think that highlights just two of the many public health priorities that we are watching very closely in terms of how federal actions, both from a funding perspective and policy perspective, may impact the work that we do in Maryland. I think specific to both breast and cervical cancer prevention and tobacco, first, I can unequivocally say these remain major priorities for public health and for the Maryland Department of Health, and we are working to do everything we can with the resources we have. In terms of federal funding, I think that is something we are still watching closely. As Dr. Seshamani had said, it's a confusing time, and so we are getting different messages, at least right now, though we are still receiving some funding, are still getting clarity, particularly as things continue what that funding will look like. So I think the answer to the question is, first, working hard to make sure that we have access to all the resources possible, looking at, based on the funding we get, what that how that impacts our work, and then what we can possibly do at the state level. But we're committed to containing and maintaining this work in every partnership that we can.
Thank you very much, Meg, for that. And great question, Lance. I'm now going to go to a question from Scott Marcioni from WYPR, and I think this is for Michelle. What are insurance companies being asked to do to make up for this gap without the tax credits? These companies are still profitable outside of MAA negotiating rates. Are they being asked in any way to meet people where they are for insurance premiums? I guess that's for Patti and Michelle.
So I can address that from the subsidy, state subsidy perspective. So that same subsidy is coming out of our reinsurance fund. Part of that reinsurance fund is through an assessment on the carriers. So we're able to use that money to do this stopgap measure. We are also working with our carriers in looking at, again, especially the federal government changes something. Can we look at grace periods? Can we look at being a little more flexible this year, which we've done in the past on, we might extend, open enrollment. I mean, there's many different options, but our carriers are partners and they work very well with us when we go to them and ask if they can be flexible with our enrollees.
Patty, did you want to add anything?
Yeah, I will share a consumer advisory about the 2026 rates that we put out about a month ago. I think that'll be helpful in understanding rate approval, understanding, what has factored in to it's an average of a 13% rate increase in Maryland for 2026. Our actuaries did take into consideration that possibly due to the loss of the enhanced tax credits that some people might be leaving the market, and then that would affect rates, as well as, with regards to medical costs. We are looking at some higher prescription drug costs, looking at about a 10% increase over last year. And so that information is captured in that consumer advisory, and I'm going to go ahead and share that in the chat.
Thank you, Patty. Anybody else want to comment on that? Let me read just two comments. Patrice Wallace says, exciting news from what you said, Michele. So about the small business. And this is a note from Joshua Grammer. Thank you very much for this webinar. It was very informative. I have another meeting, so I have to head off. Thank you for all your work from all of us here at the office of Congresswoman April McClaney Delaney. And thank you, Congresswoman, for all you're doing to protect the tax credits. From anonymous attendee, good afternoon. How can my 26-year-old son, who has an individual disability but high functioning, maintain his Maryland Health Connection health insurance?
So 26 years old, probably rolling off mom and dad's health insurance plan. Come in any one of our channels, whether it's a call center, online, our broker, our consumer assistance worker. We're happy to help get your son enrolled in coverage.
Thank you. And whoever wrote that, just reach out to us and we'll connect you with who you need to be connected with, and we'll help your son. Thank you for that question and good luck to him. From Fred Cohen, what can community health care activists do to better promote the programs discussed today on this webinar in our respective counties and advocate for our community members? From Fran Cohen. Any thoughts?
Can I answer that, Vinny?
Yeah.
There are several things that you can do from the standpoint of one, getting involved, getting engaged, going back to your community places where you eat, have activities, and share the information there. One of the places that I find that's very amenable to this is your faith communities. Faith communities are very trusted places to go, and you can very well set something up there to share it. And then, of course, I have to say that Healthcare for All will be amenable, right, Vinny, to make sure you get the information that you need to share. In addition to all the people that are here, we'd be happy to help you set that up. I also encourage people to do exactly this too. We used to have health ministries in our churches, and some of us have gotten away from that. I would encourage you to do that kind of stuff or communicate those kinds of things in your communities, or form what I call social justice impact ministries, where you get involved, where you really do get connected and stay connected. And the one thing that I did not say, I don't think early on, is that no matter what you do, you have to be continuing with your what you're working on.
Thank you. And we'll be happy to help you, Fran, to make that happen. Okay, next question from anonymous attendee. There have been many challenges to the Medicaid redetermination process in Maryland, including people losing their coverage not due to any fault of their own. Can you please share what is being done to address this staff turnover and database information sharing issues that are causing some of these major challenges? I want to turn this over to Dr. Seshamani, but I want to congratulate the Maryland Health Department for being amongst the best in the nation in the unwinding and the redeterminations. Congratulations to you all, but all yours, Doctor.
Well, thank you. And I can start, and then, Perry, you should definitely chime in. I think that we very much appreciate the ongoing work that is needed to continue to improve our eligibility and redeterminations processes. You mentioned staffing, we are increasing staffing, we are working on system updates. I will also say that the improvements that we want to make really dovetails with overall system-wide improvements. Like, as Michele knows, we rolled out Maryland Benefits, a one-stop application, and we want to be able to leverage those technology platforms where possible to improve our eligibility and enrollment, streamline those processes. And that will also be very important as we are approaching implementation of HR1. But specifically on this kind of, redetermination work, we are working on the people, on the systems, on improving our end-to-end processes over short, medium, and long term. Perry, you should chime in too.
Thank you, Secretary, and thank you for that very important question. There are a few, Medicaid has different waiver processes, or I'm sorry, different enrollment processes for different types of programs. So when it comes to who is going to be the most impacted by these changes, that is what we call non-disabled adults, or the ACA adult group. And those individuals often go through the Maryland Health Benefit Exchange. And so part of what we're doing, as the Secretary mentioned, is we are leading up to the implementation of these new requirements in January 2027. We are planning and investing heavily in those systems to improve technology, to improve automation, and to make sure that people can get coverage and keep their coverage. And so that is in close partnership with Michele Eberle and her team. On another side of the house, we also have disability waivers, waivers for home and community-based services. And that we are also working to make investments in, as the Secretary just mentioned, in parts of the system, processes, in increasing staff there. So we have, I think, a top priority of the Medicaid agency right now is investing in improving enrollment and renewal processes across all of our different Medicaid programs. So it is a big focus of ours, and we're going to continue to start to make improvements, both on making sure people can just get and keep their coverage, but also on the customer service side, making sure that we have a transparent process that everyone can access and understand. So happy to talk about that more, but we are making significant investments on all ends of it.
Thank you. If no one else has anything to add, I want to turn to my friend Richard Bruning, who has a very important question. Won't Maryland have to raise funds to cover the cuts in Medicaid? I think that's for Dr. Seshamani and her team.
Well, I will say that we are definitely going to be tracking everything that is happening. We are hard at work in starting implementation around HR1. I think this is also where we do have some time to put pieces into place to see how, the market dynamics are as we figure out together what else might be helpful.
Terrific. Thank you. And now from a former person, a member of the health department, a friend of ours, Dr. Howard Haft. What is MHBE doing to strengthen primary care and encourage consumers to access more primary as a long-term strategy to lower overall healthcare costs? Michele or anybody?
Hello, Dr. Haft. I can talk to you about what we have done in our benefit design. So we are, one of the authorities that the exchange has is to define the benefit structure for our standardized benefits, what we call our value plans. And we look every year to make sure that the co-pays for visits to primary care physicians are either very low or no cost, and of course before deductible. So we encourage it through our plan design to make sure that that's a covered service. And then we do a lot of just outreach and education in how to use your benefits after you get covered. So there's a lot in terms of that. So at every opportunity we have within the levers we have, that's how we are promoting primary care coverage.
Anyone else want to add anything? Thank you, and thanks, Dr. Haft, for all your great work. From anonymous attendee, are there any social media campaigns that the state is taking to reach Marylanders and inform them both of the hikes in premiums, but also of resources ahead of open enrollment?
I'll take that one, Vinny. Yes, we actually started communicating in July, and particularly for our DACA recipients that we knew were going to lose coverage in September. So our messaging has been make sure your information in Maryland Health Connection is current. Make sure you filed your taxes if you haven't done so. But most important, if you need medical care now, go get it. Utilize your health benefits this year, and then don't put off things that you might have been putting off for next year. So we try to encourage everyone to use their coverage while delivering the message that prices will be going up. But again, our biggest message is I think the states is we are here to help. We are here to make sure we have coverage for Marylanders, and we'll get you pointed in the right direction.
Great, thanks. Anyone else want to add?
I would like to add. So, I just shared our 2026 ACA, the information about the rate increases in the chat. That is a consumer advisory that we put out. But as well, we understand that as rates go up and as consumers, they may not have the same tax credits that they've had in the past, that people are vulnerable to scams, or they are vulnerable to looking at insurance alternatives that are definitely not comprehensive insurance products. And so at the Maryland Insurance Administration, we've been trying to get out ahead of that. We just recently put out a consumer advisory about an entity called Crowd Health, which is like it's essentially a platform for crowd sharing the costs of health insurance. So we put out an advisory. This is a legal entity, but we put out an advisory so people know what it is and what it's actually going to do for them. I'll share that advisory in the chat as well. As well, we are starting to push out the information that we have on some of these health insurance limited benefit products. And so these are products that will pay, in some cases, just a small amount of the health insurance costs that you might incur in a year. And again, these are products in many cases that are legal, that are regulated by us, but that consumers should know exactly what it is that they're purchasing, if they're considering an alternative to what is on the Maryland Health Connection comprehensive health insurance.
Great, thank you. Thank you, Patti. Anybody else? Before we get to a couple other questions, I want to take a quick break for everyone to look into the camera so Stephanie can take a photo of everybody. So pose for your best photo here. Great.
Thank you.
Great. Thank you, Stephanie. So, all right, let's go to a very important question here. I think this one started with Michele, but everybody else should chime in. What is Maryland doing? He's from Lori Yelly. What is Maryland doing to help DACA recipients and lawfully present immigrants receive health insurance coverage? I know this is very difficult under the present administration in Washington.
This is a very tough one for us because the options are limited. So we are working to connect with other resources. I know I was just out in Montgomery County and we were talking about programs that they have as a county that they make available. But we have started to share our share 211 on our information, which is a statewide resource to look at where there are other areas that can provide health coverage. I know the federally qualified healthcare centers have been a resource. And of course, we know that they are concerned about being overwhelmed in funding and such. And so it is a very difficult position to be in. And I don't know, my MDH colleagues, if you have other thoughts on that.
Dr. Sullivan can chime in further, but we do also have our refugee health and immigrant health program. So, and I think we will continue to use the safety net, as we are able to be able to provide access to care.
Yeah, I think I'll just first emphasize we know that this is an incredibly tough time, and I think have to be honest in acknowledging that, but also that this remains a priority and looking first, of course, at any option for healthcare coverage, but more importantly, access to services in a more general sense. I think you mentioned very strong partnerships with our federally qualified health centers, our local health departments, so many of our other incredible organizations on the ground. I think also, and I saw another question in the chat, we know that there's simultaneously other funding cuts that are coming that are impacting those services more broadly. And so I think we are just engaged in an incredible amount of conversations about how we can leverage, again, every resource and authority we have to continue to provide coverage to all Marylanders.
Great. Yes, thank you very much. Well, we're about out of time. We have a couple of other questions that are kind of long, so it would take me a few minutes to even read them, but we will try to get back to you individually. But I just want to thank everybody on here for your leadership and for being here with us today and getting this message out. We had 200 people on here, and another 100 who want to hear the recording, we know. And I want to repeat what Reverend Dr. Sandra Conner said. Get the message out through your networks. What you heard today is for you, but also for everybody in your networks. And tomorrow starts open enrollment, and we are ready, as Reverend Conner said, to continue making progress. And I just want to close by thanking Governor Westmore for all his terrific leadership, and we are ready to keep working with you all. So thank you very, very much.
Thank you, everyone.
Thank you.
Thank you. I know.
Let's keep hope alive.
Mhm.